We're getting ready to begin. Just a moment. I want to welcome you to our press briefing with updates on COVID-19. As of this morning, we've lost some 170 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first we'll hear from the chairman of the Dougherty County Commission, Christopher Coelis.
Thank you, Chief. Good morning, everyone. Today I want to go over some specific factual information that relates to how we are responding to the coronavirus pandemic, where we are in our current progress, and to provide everyone with just some factual updates about what we're doing and how things are progressing. One of the things that we started on very early on in this community was compiling accurate data from all of the different data sources that we could possibly gain that information from the Department of Public Health, from EMS, from Phoebe Putney Memorial Hospital, from the various different testing facilities that we have in the community, so that we could actually get a real-time picture of where we were in terms of our progression with this pandemic. And I want to thank the city, I want to thank the county, I want to thank all of the members of our COVID task force for working to compile this information, because this information is actually more accurate and more real time than a lot of the information that we can ultimately get that's reported back up to the state. And that's not to say that the information that the state has is less accurate. Ours is just in more real time because we're aggregating it at the local level. In other words, we have these people working together. At times during this pandemic, we were talking 7 days a week. Now we're meeting once to twice a week via teleconference, depending on the need to respond and where we're at in the current pandemic. That being said, the current slide that we have up on the screen is an example of some of the information that we continue to compile. And I want to talk about where we are right now in comparison to where we were back in March, April, and May. We have been experiencing what people have called a second spike, or a second wave, or a second resurgence. Whatever you want to call it, it basically means you have people that are moving around, that we are going back to a more normal way of life, and as such, the transmission levels have gone up. But we also have the benefit of knowing that we have social distancing. We've changed our culture. Many of us are doing the right thing by wearing masks when we go out into public. We're making sure that we wash our hands. And so that is helping in terms of how we combat the virus. However, we are seeing an increase. Hopefully, of 2 days ago, it may start to be flattening again. But I do think that it's very important that we be very mindful of this information so that we don't allow ourselves to get to a place where we were in March, April, and May, where things seemed so apocalyptic. They seemed so hopeless. We had so many people that were passing away and that were becoming vulnerable to this virus. And so, as you see on the screen, we had a huge spike back in late March, in April, and moving into close to May, and it was very, very significant. Now, we are experiencing a resurgence. And one of the things that signals to us that we are experiencing a resurgence in the virus is when the total number of people tested, You view that as a pie, like we have on the screen right here. You have a total number of people tested, and then you identify what percentage of those people are actually testing positive. And right now, we're currently trending at about 13% of the people that are being tested are testing positive. Now, is that corresponding to the same death rate that we experienced in March, April, and May? No, it's not, and that's a very good thing. But it does let us know that we are experiencing an increase in the overall transmission rate. Is our transmission rate the highest in the state or the highest in the world? No. Are we anywhere near where we were in March, April, and May of earlier this year? Absolutely not. But this just continues to reaffirm that we have to continue to do the things that we know that allowed us to flatten the curve in the first place. Social distancing, wearing masks, washing your hands, not having unnecessary contact with too many people, avoiding large gatherings, being mindful of how we move through this world and this community, and thinking about every decision that we make about whether or not it would affect someone else. And I think this is really important information for us to look at, because we know this about the virus. Many people have it and never know that never know that they had it. Some have it and they have very mild symptoms. And in fact, most of the people that have the virus have mild to moderate symptoms when they experience symptoms. And then there are a group of people that have to be hospitalized, and they experience significant, sometimes severe, and sometimes fatal results as a result of the virus. And obviously, our goal with anything in this community is to preserve lives and to preserve the health and safety of our citizens. And that's very important for us. And so how do we look at this information and discern what we need to discern? Well, if we look back in March of this year, the total number of admissions at Phoebe for COVID-19, that means people that had the virus, their symptoms were so significant that they had to be hospitalized. That was 306 people in March. It was a very large number. April, 405 people. And in both of those months, we experienced very high death rates. And many of those patients, many of those 306 and many of those 405 passed away at the hospital. 56 in March, 38 in April. And then we flattened the curve in May, and we flattened the curve in June. And now we're going back to a more free way of life, which is also consistent with the human experience. It's also the way that we have to operate in order to support our families, the way that we have to operate in order to work at our jobs, the way that we have to operate in order to just have a normal human experience or some semblance of that. But we also have to continue to be diligent, because as we move through this world and we continue to try and embrace the things that make us humans, that make us, part of the Albany experience, we have to be mindful in order to keep these numbers down. And what we're seeing now in May and June, the numbers went down. We went from April, we had 405 admissions, to June where we only had 64. And then in July, we had 188. Is that as bad as March? No. Is it as bad as April? No. Is it trending in the wrong direction? Yes. Is it consistent with what is going on around the country and the state and the world in terms of a second resurgence? Yes, it is. What were our total number of deaths in June? 5. Total number of deaths in July? 13. And I've said this, and I'll continue to say this again and again. Each life is too many. And we always have to continue to be mindful that the things that we do, the way that we interact, the places that we go, whether or not we wear a mask. And I've heard this again and again, and I want to address this. We have many young people in this community that feel that they're immune to the virus. And they feel like they don't have any responsibility to do anything. They don't want to wear a mask. They don't want to wash their hands. They want to continue to go to large parties and do X, Y, and Z. I would ask each one of those young people to consider for a second the value, the love, the experience that their grandparents, that their elderly, that their parents, that the people that they know, that they have in their lives. as in terms of relationships, people that are medically vulnerable. I would ask them to imagine the possibility that their irresponsibility may cause that loved one's death. Because that is the reality of what happens with this virus. And we have to continue to be diligent, and we have to think not just of ourselves and in terms of whether or not I do or don't have symptoms, or I do or I don't have a strong immune system. We have to think for everyone. We have to be smart, we have to be strong, we have to make good decisions, we need to get tested. If you've been exposed, or you feel like you've been exposed, or you're exhibiting symptoms, get tested. We have a lot of great information that is coming out, and I was really encouraged to hear, and I think I mentioned this at the last press conference, that the CDC has mentioned that there is no credible evidence that those that have contracted the virus and actually overcome the virus have recontracted it within 6 months. And that is highly suggestive that there is a degree of immunity that arrives from having had the virus and having experienced it. And so that information provides us with information so that we can make decisions on how we shape policy, how we encourage businesses to do certain things. And I'm very encouraged by the large number of businesses that we have in this community that have embraced unified standards of how they're going to allow people to come into their stores, how they're going to allow them to continue to do business, to shop, to do the things that we need to have done. The different stores that I've seen that have required masks of every single person that comes in, I think that's far better that businesses make those decisions in terms of being good corporate stewards for our community and thinking and paying it forward. We need to continue to do that. I think we're also going to see some programs arrive in this community where we continue to try and unify the standards amongst our business community and how they approach COVID-19, because ultimately a community is a collection of businesses and people and citizens, all who are inextricably intertwined. And a rising tide floats all boats. And if we have everyone rowing in the same direction, we can continue to do what we have done in the face of tremendous adversity. And we're not in that place where we're number 3 in the world anymore. And what I want to challenge people to do and to think in a different way, because I really can't stand terms of a victim mentality. Our community was hit harder than any other community in the United States when this thing first came on. And frankly, we flattened the curve faster than any other community that I can think of. We worked hard. We took swift action. Our community pulled together. Our first responders did an outstanding job. Healthcare workers dug in. They worked double shifts. We distributed masks. We changed public policy. And we shifted the curve. And rather than us imagining ourselves as, oh my gosh, we had all of these horrible apocalyptic things that happened to us. Woe is me. I think we need to think in different terms, because this pandemic is not unique to us. It's not unique to the state of Georgia. It's not unique to this region of the country or any other country in the world. Everyone is experiencing it. And frankly, if we can continue to do the things that I know that we can do and that we have been doing, we can actually establish ourselves and continue to establish ourselves as being the community that responded best, the community that establishes itself as one of the safest in the community and one of the smartest in the country. I travel a fair amount and still have to travel in spite of the pandemic, consistent with the guidelines that have had to be put out there. And I've seen other communities. They're not masking up the same way that we are. They aren't embracing the things that we are. Do we still have people that make bad mistakes and bad decisions? Absolutely. Do we still have some businesses that absolutely try and take advantage of some of the fluctuations in the marketplace and try to make a lot of cash money by bringing a lot of people together at parties or different events that frankly are not safe? Yes. Are we different in that regard than any other community around the state or the country? Absolutely not. But as a whole, we've done a great job. And as we continue to move forward, and I think at the next press conference, we'll have a more specific example of this, and I've talked about it before. We're about to deploy antibody testing. That is going to give us an excellent picture of what our overall immunity looks like, what our overall infection rate looks like. It's going to allow us to articulate and speak on behalf of ourselves, to talk honestly with real data about the fact that we are a safe community to do business in. As long as everyone follows the rules, we are no different than anywhere else. The air here is no different than the air in Columbus, in Macon, in Atlanta, anywhere. What is different here is in how we have conducted ourselves, how we have distinguished ourselves, and how we have pulled together. Thank you.
Thank you, Mr. Chairman, for your remarks. We'll now hear from City of Albany Mayor Bo Durrell.
Thank you, Chief. Chairman Cohilas did a good job of an overview, and I don't want to repeat what he says or anticipate what Dr. Kitchens will speak to later. But one thing about this antibody testing, it was discussed in one of the task force meetings that one of the earliest antibody testing was conducted in Newark or someplace in New Jersey, and lo and behold, more than 30% of the people had the antibodies, and that was far in excess of the number of people who had tested positive during the height of the pandemic there. Some figures, and I think these are correct, but Dr. Kitchens can address it, to show how the virus is spreading in the community. I just want to use at Phoebe Putney, the two local hospitals, on the week ending July 15th, the average number of COVID patients was 44 and a half. The week ending July 22nd, the average number of COVID patients was 54. The week ending July 29th, the average number of COVID patients was 61. And I believe for the week ending August 5th, the average number of COVID patients was 64. And even though there is an increase, you see that it is somewhat positive because the rate of increase seems to have slowed. That is the local issue. I would go into the Johns Hopkins website, and I would encourage everyone to access that website. It has excellent information. Let me give you some statistics about the state of Georgia. On June 30th, there were 80,575 confirmed cases. July 31st, that number had risen to 186,352. Again, from 80,500 confirmed cases from March to the end of June. And then we had another 106,000 cases in the month of July only. So we need to understand that. Georgia jumped up from being like the ninth state to the fifth. And under some categories, you can see that New Jersey's still ahead of Georgia, but Georgia at 186,352 cases. Now, let me give you some numbers. That's more than 1,000 new cases each day since June 19th. Since June 28th, we've had more than 2,000 cases, new cases per day. And in the last 2 weeks of July, the average was over 3,700 new cases. And of course, some of this is a function of the broader testing, but what we need to understand is the virus is still present with us, and it is spreading. Now, the number of deaths, Mr. Cohilas suggested earlier, the proportion of the deaths is certainly not in keeping with the new cases. On July 30th, the death toll was 2,805 for the state of Georgia, and at the end of July, that had increased by less than 1,000. The death toll was 3,752. I want to invite everyone's attention. There are two pamphlets that came out about resetting the way we fight the pandemic. One's from Johns Hopkins Center for Health Security. The other is from the Association of American Medical Colleges. And at this point in time, I think we are having some advice that we need to heed from the medical community about how we as a society deal with the virus. We know so much more. And one thing that we can attribute the declining death toll to is that hospitals and physicians and other healthcare professionals are much more knowledgeable as to how we can treat the virus at this time and combat the virus and treat patients with the virus. There have been concerns that we might have a further spread of the virus once schools reopen. That's a difficult decision for many, many reasons. We hear proponents of opening schools saying that it's essential to the developmental and social skills of young children, that there is an emotional and psychological impact that most of us, upon young children, that most of us are not fully comprehending, and also to the intellectual development, particularly of at-risk youth. Now, when I talk about these pamphlets, there are things that if we see a spike, if we heed the medical community, we are probably going to go back into some type of broad restrictions. But one thing that's pointed out is we don't need to mirror the mitigation procedures which were implemented in the spring. In other words, we've heard people talk about we have to coexist with the virus. We cannot shut down our economy. We cannot shield ourselves in our homes. And these are very practical, and I think they would be successful measures. Universal mask wearing, no surprise, is recommended, but also certain things like closing gyms, closing nightclubs and bars until we get a handle, or at least through the flu season. And so what we might be seeing is some more stringent restrictions in the coming weeks and months. And what I want to speak to you about in closing is something that has been on very few of our mind, and that is the census. The census is going to determine how much funding local communities get for health care, education, roads, and highways. Our participation in Dougherty County appears to be less than 60%. We have learned only this week that the federal government has set a new deadline, which was originally 2 more months. We have only 10 more weeks. And so I want everyone in the community to discuss this, to be cognizant of it. And what we need to do is encourage our friends and neighbors and family members to simply complete the census form and get that information back. If you have any questions about it, you can call the city. We can give you assistance. But again, we would call upon community leaders, people in the faith-based community, to encourage and actually participate in the last few weeks of the census count. Thank you.
Thank you, Mr. Mayor, for your comments today. We will now hear from our representative from Phoebe Putney Memorial Hospital, the Chief Medical Officer, Phoebe Putney, Dr. Stephen Kitchen.
Chief, thanks so much. I think many of the remarks I'm going to make have been referenced both from the remarks of Chairman Kohelas as well as Mayor Durham as well. But I would like to provide this update of Phoebe Putney, and if we could possibly refer to the slide that has the COVID-19 update. Let's see, it's not that slide, but if we could advance. Yes, right there. So if you refer to this slide and you look at the slide that's on the upper left that said COVID-19 census across the system, you have the orange and the blue graph there. And I think what this illustrates is that we had a dramatic and kind of overwhelming number of patients who were coming into Phoebe facilities in mid to late March and well into April as well. We talked about flattening of the curve, and so, fortunately what we experienced through the month of May and through most of the month of June was that average daily census really began to decline in a significant fashion. And then really what we have witnessed over the last 6 weeks or so is that we've seen a gradual increase in the number of patients who have required admission to Phoebe facilities here in Albany, in Americus, and in Sumter as well. So if you refer to the graph that's really on the far upper right, that shows the number of daily admissions that we have. And, like I said, really through most of the month of June, the daily admissions were well down into single digits and usually less than 5. And what we have noticed throughout the month of July is that the number of daily admissions has increased and actually got up into the 10 to 12 range for most of the middle part of July. This time last week, our average daily census of COVID positive patients at Phoebe Putney in Albany was averaging about 65. We've seen a little bit of decline in that. That number was actually 57 this morning. But I think the phenomenon that we're seeing now, and I think, again, this has been what's been referenced by Chairman Cohilas and Mayor Dura as well. I think realistically, we can expect that we're going to continue to see some fluctuations in the number of patients or number of people who test positive in the community and who require admission as well. So I think we realistically will continue to see some fluctuation in those numbers, but certainly I think most notably there has been a significant increase, not only locally but statewide and nationwide in the month of July. I think there are several factors at play there, but again, we have seen a significant increase in the number of patients requiring admission in our overall census throughout the month of July. If we could go to the next slide, and I think this was the same slide that Chairman Cohilas referenced, but I think it is very helpful, and I think it certainly gives a very representative picture of what we have seen. So I'm going to go through this again. Obviously, Albany was one of the hot spots, not only in the state, but in the nation and the world in March and April. And I just want to underscore, the 306 admissions in March and the 405 in April were orders of magnitude greater than what most hospitals, even large academic hospitals, were seeing across the nation at that point. So, in March, we were averaging about 22 COVID positive admissions a day. Our average daily COVID census was 81, and 56 of the deaths that occurred in March. And I will tell you, for reasons that we don't fully understand, the overall what we call acuity of patients, how sick they were when they were coming into our emergency room was unprecedented in the month of March. Maybe it's because it was such a new, novel new novel virus at that time. And so, just the degree of immunity that people are beginning to demonstrate may have some impact, because the overall acuity of patients that we're seeing now, the number of patients and the percentage of patients that are requiring admission to the intensive care unit is much lower now than it was in March and April. April was when we peaked. We had 405 admissions, average admissions 13 and a half a day. Average daily census was 122. And, the other thing to bear in mind, the average length of stay was very long at that point. So you have many people who were admitted in March who were still hospitalized in the month of April, and that's why that average daily census was much higher in April, and actually peaked in the month of April at about 160. There were 38 deaths that occurred. May, we began to see a notable decline, 111 admissions, dramatic decrease in the number of admissions per day, 3.6, average daily census of 60, and 10 deaths. That trend further continued in June with a total of 64 admissions. We were down to 2.1 admissions a day. Compare that to 21 admissions in March. So a tenfold decrease gives you an idea, and I think that was due to a lot of the socially responsible behaviors that were in place then. People were masking, adhering to social distancing, that sort of thing. And fortunately, we only had 5 deaths that occurred in the month of June. Notably, there has been a significant increase in July. 188 admissions, 6 admissions per day, average daily census of 53, and a total of 13 deaths. So, again, I think what we're seeing is the same phenomenon that's being seen in Tifton, Valdosta, Moultrie, Bainbridge, across the state, in that the degree of community transmission has picked up significantly. And, I do think we're just going to have to prepare ourselves to the fact the virus is going to be with us for a while. And I think we do have the ability to significantly decrease or mitigate the impact it will have by, again, I may sound like a little bit of a broken record, but the 3 or 4 really big things are masking, adhering to social distancing, being very careful and vigilant in hand hygiene, and avoiding large groups. I think, there's many promising developments on the horizon. I think, as I mentioned last week, over 120 potential vaccines are being studied at this point, with probably a handful, 12 or more, that have active clinical trials that are going, and at least to date are showing significant promise in terms of conferring immunity to people who receive the vaccine. So I do think that's going to ultimately be the best promise down the road. And as Mayor Dura recently referenced in his remarks, what I will tell you, at our hospital, but really at every hospital in the nation, our understanding and our knowledge of what we call the pathophysiology of the virus, how to best treat and manage it, continues to improve. We continue to have a very active quality improvement group totally devoted to COVID-19. Actually met yesterday, and what I will tell you is that our clinical outcomes continue to improve. The overall mortality rate continues to decrease, but we still need to be mindful of the fact it has the potential to be a very devastating and fatal virus that we need to continue to do everything we can from a responsibility standpoint to mitigate the impact of the virus in our community, in our state, and in our nation. Thank you.
Thank you, Dr. Kitchen, for your update today. We will now hear from a representative from Public Health, the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Lewis.
Good afternoon. I would like to start by reviewing a couple of medical terms that we hear a lot, but even though we may have a pretty good grasp, it's sometimes a good idea to go back and review to make sure that we're speaking clearly to one another. So I want to talk about the terms of isolation and quarantine, two terms that we hear about often, but we sometimes get them confused. So isolation basically is a period of time where we separate people, and isolation is for people who are sick or for people who have tested positive for COVID. Quarantining is a period of time when we separate people who have been exposed to someone who has the virus or who probably has the virus. We separate those people to watch and see if they are going to get sick themselves. So the duration of isolation and the duration of quarantining is something that is easy to get a little bit confused over. And I'd like to explain the time period and why we have chosen those time periods. So let's start with quarantining. If I were to be exposed to COVID-19 virus today, I may get sick, but I'm not going to get sick today or tomorrow. It takes the germ at least about 48 hours inside the human body before it replicates, reproduces, and makes the person sick. So it'll be about 48 hours at least before I might get sick. I might get sick on the third day, the fourth day, and so on. I might get sick as far out as the 14th day after my exposure. That's the incubation period, 2 to 14 days. That's why I should quarantine for the full 14 days unless I become sick myself. So after 14 days of beyond exposure, it's extremely unlikely that a person will become sick. So that is quarantining. After 14 days, I can come out. For isolation, the reason why isolation is generally 10 days is because the vast majority of people who become sick with COVID-19 will reach a point by the 10th day where they are no longer contagious. They might still have some symptoms, but in the vast majority, like 99% of people who have COVID-19 who recover from it will no longer be contagious after 10 days. And it's puzzling sometimes because people will say, well, if I'm sick, I only have to separate for 10 days. If I'm not sick, I have to separate for 14 days. But as you can see, the reason is because in isolation, usually after 10 days, we're not a danger to anyone. But when we're quarantining, we just don't know if we're going to be sick or not until we wait the full 14 days. Now, there's some good news involving testing in the Southwest Georgia Health District. We gather specimens in 9 different locations. We do not perform the tests ourselves. We send the samples to a reference laboratory, and we are sort of at their mercy as far as the turnaround time. In the last few weeks, the turnaround time has been around 5 or 6 days. And this week, we have seen some improvement. This week, we have seen the turnaround time in some places as quickly as 48 hours. So we're very optimistic about that. That's going to help us to make an assessment of how sick individuals are and how sick the community is going forward. So we do want to encourage testing. It's a very important component of our response to COVID-19. And sometimes we're asked, well, who should be tested? Well, I want to talk primarily about those two groups that I just mentioned, those who are on isolation, those who are symptomatic, and then those who are quarantined, the folks who have been exposed. If you are symptomatic with COVID-19, and that includes quite a list of symptoms, including fever, cough, shortness of breath, headache, sore throat, body aches, loss of smell and taste, congestion in the nose. If you have any of those kind of symptoms, you should be tested. And we would like you to get tested as soon as possible, but bear in mind, you should also be isolating. You should be staying at home and only get out of the home for medical reasons, and to get tested would be a medical reason. We want you to get tested quickly. Now, for those who have been exposed, people who should be on quarantine, we do want you to be tested, but generally, we don't want you to get tested immediately after exposure. And the reason is because of what I said a few minutes ago. If you're exposed today and you get tested today or tomorrow, it's not going to tell us anything. It takes a couple of days. Actually, if you have been exposed to the virus, if you're only going to get one test, we would prefer that you wait till about the 8th or 10th day after exposure, but we do want you to get tested. Now, I want to make it perfectly clear. If you're on quarantine, that's a 14-day period beyond the most recent exposure. If you get tested while you're on quarantine, and if the result is negative, that is good news, but all it tells us is that you did not have evidence of the disease at the time of your test. It doesn't tell us if you're going to have the disease the next day or the next. So testing during the quarantine period, even if it's a negative test, it doesn't allow us to alter the length of quarantining. We have to wait the full 14 days because you could be tested negative one day during quarantine and you could be sick the next. So where to get tested is the next question. We have 9 different locations in our health district. For those who may not be able to see the screens, we have sites in the following counties: Colquitt, Decatur, Dougherty, Grady, Lee, Mitchell, Terrell, Thomas, and Worth County. It is best if you will make an appointment to get your test. It means that if everybody gets an appointment, there's much less waiting in line. It allows us to prepare for the number of people we will be serving. We can match our staff up with the number of people that will be coming in. We can make sure we have enough testing supplies to get the job done. So please make an appointment. There are 2 different ways. It works best if you go online to make your appointment. And one reason for that is you can do it 24 hours a day, and you can see the available appointments, and you can make your own selection. There's one exception. Currently, Colquitt County is not set up for making those appointments online, but everyone else is. And it's easy to do. You can go to www.covid19.dph.ga.gov. It's easy to do. An alternative is to call to make an appointment. And again, for Colquitt County, you will have to call if you want to make an appointment. The number is 229-352-6567. 352-6567. Operators are there Monday through Saturday to help you make an appointment. Also, if you can't remember that website, if you call that number to make an appointment, the automated message will give you that website again that you can go to make the appointment. And again, this shows, again, the website, covid19.dph.ga.gov. So we do want to encourage people to get tested. Now I want to switch and talk about people who do not need to get tested, people who should not get tested. In general, if you have been diagnosed with COVID-19, and if you have had a positive test, once you have that first positive test, there is almost never a reason to have another COVID-19 test, certainly not within the next 90 days. One reason I say that is because when we have a COVID-19 infection in our system, what the test does is actually it detects the genetic material for the virus. And generally, that material is going to linger in our system for up to 3 months. After 10 days, it's usually not in a form that is contagious to others, yet it will linger. So if you get a test again, you're probably going to show positive again, even though you may have totally recovered. One of the problems that we're running into is employers continue to insist that their employees stay out of work until they can test negative, and in some cases, they're requiring them to test negative on 2 different occasions. So you can see from the science that's not logical, because we're usually going to continue to test positive weeks and weeks and weeks beyond the time that the infection is gone. Another thing is it wastes valuable supplies that we need to use in cases where the information will truly be valuable to us. Another thing is it really discriminates against innocent people who have had a disease that they could not help. And by keeping them out of work in this manner, it's really just not unfair. So if employers want to know more about the science behind this, please call your health department. We can talk it over with you and explain to you why public health and the CDC strongly discourage testing people after they've recovered from COVID just to go back to work. I want to close by reminding you that we are still in a COVID-19 pandemic. People are still getting sick. People are still getting hospitalized with COVID-19. People are still dying with COVID-19. The worst of this pandemic might very well be in our future. So let's all work together to control the spread of this virus by doing the things that we have heard many times. If you're sick, stay home except for getting tested. Wash your hands, wear a mask, practice social distancing, and disinfect hard surfaces. Thank you.
Thank you, Dr. Ruiz, for your remarks today. We will now hear updates from the Dougherty County Coroner, Mr. Michael Fowler.
Good morning. I'm here to give you some more updates from the last meeting to now on what we have at this present time. We have 169 deaths in Dougherty County, residents of Dougherty County. I know some of the stats that Chairman and Dr. Kitchen given, those are deaths that happen in the hospital. And the hospital death can be individual from Lee County, Colquitt, Sumter, and other counties. But the death, the residents here in Dougherty County, we have 169 positive deaths in Dougherty County. Since the last update, we've had 2 more deaths here in Dougherty County since the last presentation that I gave, 2 more females. We had 97 females, now we have 99 females that have passed in Dougherty County from residents here, and also 70 males here in Dougherty County. And the 2 more females, they, 2 more individuals that died was black. So we had 132 blacks, now we have 134. We still have 34 whites and 1 Latino. And this stats here, only thing changed was the 2 black females. We had 1 Latino male, 25 white female, 10 white males, and we have 73 black females and 60 black males. The chart from last week compared to this, the only thing changed was we had 1 of the individuals in the 80s, so now we have 35 individuals that died in the 80s, and in the 70s we have 45 individuals that died in the 70s. And everything else still remained the same from last week. From June to now, the death rate have declined tremendously here in Dougherty County, residents here in Dougherty County. From June the 1st to June the 6th, you see 1 death that week. June the 7th through the 13th, 1 death. June the 14th through the 20th, we had 3 deaths. June the 21st through the 27th, we had 0 death in Dougherty County residents here. But you can see the numbers as they decline. July the 5th through the 11th, we went up to 4. We dropped back down from the 12th through the 18th, 2 deaths. July the 19th through the 25th, we had 4 deaths. July the 26th through August the 1st, we had 2 deaths. And of August the 2nd through now, we have just 1 death. This is a breakdown of the death of residents here in Dougherty County that had passed. March, we had 38 deaths. April, we had a total of 86 deaths. That was our peak. May, we had 26 deaths. June, we dropped down to 6. July, we went up to 11. In August, so far, we've had 2 deaths in Dougherty County. The testing, what I spoke on last week, as far as the testing wise, Phoebe Putnam Hospital, along with the Department of Public Health, along with the coroner's office, have gotten together, and now we have a solution that we will make sure that the individuals that need to be tested in the come in the ER from out in the field into the ER to be pronounced will be tested. So, and I want to say masked up. I know many events that's going on. I see flyers out and different things going on. If you're going to go out, you need to put a mask on. I know the death rate is down, but we can also turn it back around, start going the wrong way. There are many individuals that are being sick with positive results. But like I said, I think the hospital and the medical field have came over and getting better with the solution for saving lives. So like I said, in August, we have only had 2 deaths. And last month, like I said, you can see the death rate is declining. So we want to keep that trend going. We'd like to have 0 death again like we did in July. But again, mask up, Albany. Thank you.
Thank you, Coroner Fowler, for your remarks today. We will now pause for questions from the media. Please.
For Dr. Ruiz, we've had some questions about the accuracy of tests, maybe people getting false positives or false negatives. Can you maybe speak to that and the accuracy of the COVID-19 tests?
Dr. Ruiz?
I'm sorry, I think I heard most of the question, but can you repeat that again, please?
We just had a couple questions about the accuracy of COVID-19 tests. Some people getting false positives or false negatives.
That's a good discussion to have. It's probably good to make it clear at the top what kind of COVID tests we're talking about. And I would say that generally we're talking about 3 different type of tests. First of all, the antibody tests that the mayor mentioned earlier, or perhaps it was the chairman that mentioned it. Those are useful tests when trying to determine how many people in a population have already been exposed and perhaps recovered from COVID. The antibody tests, though, don't really have a place as far as diagnosing acute infections. So it's a test, but it doesn't involve the diagnosis. So when we're talking about the diagnosis, primarily there are 2 different tests. The one I was referring to earlier is the one that tests for the genetic material of the virus. That is frequently referred to as PCR, and that stands for polymerase chain reaction. And that was the original test that we started using back in the spring, and we continue to use the PCR test. In public health, the PCR test is considered the standard. We use that to confirm COVID-19 infections. Another test that is also used more and more nowadays is an antigen test. And the antigen test looks for a particular structure that's on the surface of the virus. And antigen tests are widely used in medicine to diagnose a variety of illnesses, meningitis, for instance, but there are many that are used. And antigen tests are good tests. When we are looking at the value of a laboratory test, there are several things that we look at. The accuracy, of course, is paramount. We don't like false positives because that would lead to overdiagnosing cases. We don't like false negatives because when you have a false negative, what you have is someone who really is sick, but the test leads you to believe that they are not sick. With PCR tests, the best way to do a PCR test is with a standard laboratory, which involves highly sophisticated machinery or instrumentation. The instruments are calibrated continuously, and those are the best tests to have. The accuracy rate is very high, and I do believe Phoebe Putney has that type of instrument. Our reference lab uses that type of instrument. So you can generally count on the results, whether it's positive or negative. With rapid tests, and most of the antigen tests are rapid tests, they tend to be pretty good at picking up on, they tend to be pretty good as far as when it's a positive test, that's usually accurate. You don't get many false positives. So that's a good thing about the antigen tests that are rapid in nature. But when the antigen test has a negative result, different sources say that it is inaccurate between 15 and 40% of the time. So that would mean out of 100 people that actually have the disease, if you use one of those rapid tests, let's say 15 are wrong. So you would be telling 15 people out of 100, you're okay, you don't have the disease, when actually they do. So I'm not sure if that answers your question or not, but to sum it up, a standard PCR test, we believe, is the best accuracy. And as far as the rapid antigen test, we tend to trust it if it says that it's positive. If it's negative, we have limited confidence in the result.
And you said it's taking it just a little bit longer on the test that you guys are using right now?
To get the results?
Yeah.
Well, it's actually improved. There was a backlog at the laboratory. They had so many tests, and it exceeded their capacity, and it was taking us about 5 or 6 days. And that has come down now to about 48 hours.
Okay.
And one of the reasons for that is that laboratory has expanded by adding more equipment and more employees. And the state also has entered into a contract with an additional laboratory. So we have more resources. And we think that this quicker turnaround time, we think, is here to stay. And that'll help us a lot. Our goal is to get down to 24 hours, but 48 hours is a pretty good turnaround time when you're considering a very reliable test result.
And how many tests are you guys performing right now, like on a weekly basis in the week?
In public health, here in the Southwest Georgia Health District, we are doing in the neighborhood of about 1,000 to 2,000. It's more like 1,000 to 1,500 a week.
Okay, thank you, Dr. Lewis. Any additional questions? Okay, that will conclude our press briefing for the day. I will remind you that the Emergency Operations Center is open Monday through Friday and can be reached 229-302-1900, and would ask that you join us for our next press briefing next Friday here at 10 a.m. We'll see you then. Remember, mask up, Albany, mask up, Doherty County. Thank you.